Good evening, my dear students. So today we will be discussing about two types of respiratory disease. So this is the main crux of respiratory physiology to differentiate between two types of disease. One is called as obstructive lung disease, other is called as restrictive lung disease. So this can be understood if you know the basics. For example, if we talk about the lung physiology, okay, in the lung we can get the airways and we can get the parenchyma. So whenever there is any problem of the airways, okay, it can cause obstructive lung disease. And whenever there is any problem of the parenchyma, like fibrosis, asbestosis, okay, that are called as restrictive lung disease. So one is obstructive lung disease, other is restrictive lung disease. So whole respiratory physiology is basically based on this concept, how to differentiate between obstructive disease and the restrictive disease. In your MBBS case also, a lot of questions are based only on this concept, how you will differentiate whether it is an obstructive disease or a restrictive disease. So once for all, let it be clear that whenever there is an airway problem, it is obstructive and parenchymal problem is restrictive. Now, what is the central theme of restrictive lung disease? It is it is decrease in the diffusion capacity. It is decrease in the diffusion capacity. I mean, there is fibrosis. So lungs cannot expand. Lungs cannot expand. Okay. And when we talk about the obstructive lung disease, okay, it can be centered by a single point, and that is trapping of air in the lung parenchyma, in the airways. So when we expire, some air will got trapped in the lung, increasing the total lung capacity, increasing the volume, increasing the compliance. So the center point of restrictive lung disease is what? It is restriction in the expansion. Okay, so you can say decrease in the diffusion capacity because of the fibrosis. And the center theme of obstructive lung disease is what? It is very simple, trapping of the air. This is clear? Now, tell me about total lung capacity. Total lung capacity, because of the trapping in obstructive lung disease, will increase, isn't it? The total lung capacity will increase. On other hand, in restrictive lung disease, that will decrease. Now, what about FeV1 by FVC? It is called as Tiffnews index. You know that FeV1 by FVC is called as Tiffnews index. So Tiffnews index, if it is less than 70, okay, 100% it is obstructive lung disease. Tiffnews index is FeV1 by FVC. And if FeV1 by FVC is more than 70%, there can be two problem. Not two problem, there can be two cases. Either it can be restrictive lung disease or it can be normal also. I mean, in the normal condition also, we have FeV1 by FVC greater than 70%. Is this clear? This much is clear. So Tiffnews index less than 70%, obstructive lung disease more than 70%, either normal or restrictive lung disease. This much is clear. Now, how you will differentiate whether patient is normal or patient has restrictive lung disease? Because both will have the ratio more than 70%. Now you will look into the individual value. If FeV1 is less than normal, if FVC is less than normal, but ratio is more than 70%, patient is normal. Are you getting me? So ratio is more than 70%, but individually, if FeV1 less than 7, I mean FeV1 less than normal and FVC is less than normal, then patient is normal. On other hand, if FeV1 is very very less than normal, okay, are you getting me? If FeV1 and FVC both are absolutely almost more or less equal to normal, patient is normal. But if they are very, very lesser than normal, it is restrictive lung disease. So once again, if FeV1 by FVC is more than 70%, you have to check for individual value. Individual value means if FeV1 is normal, FVC is normal, but ratio is more than 70%, patient is normal. But individually, if FeV1 is less, FVC is less, but ratio is more, answer is restrictive lung disease. Clear? So now we are able to differentiate between obstructive lung disease and restrictive lung disease. Now, which is the only capacity that is less in both OLD as well as RLD? Answer is vital capacity. If you know respiratory physiology, you know vital capacity. So vital capacity is the only capacity that is less in both either obstructive lung disease or in restrictive lung disease. Is this clear? So once again, let me recap whatever we have discussed. There are two types of ailments in the respiratory physiology. One is OLD, other is RLD. OLD, there is a trapping of air during expiration. In the OLD, there is trapping of air during expiration. So total lung capacity will be high. In RLD, the center point is that because of the fibrosis, their diffusion capacity will be less. Next point, FeV1 by FVC. It is called a stiffness index. If it is less than 70%, okay, 100% patient is of obstructive lung disease. If it is more than 70%, I told you either patient can be normal or patient can be of restrictive lung disease. Now, how to differentiate between these two? FEV1 normal, FVC normal, but ratio more than 70%, patient is normal. FEV1 less than normal, FVC less than normal, but ratio more than 70%, patient is having restrictive lung disease. Now, the only capacity where which is decreased in both obstructive as well as restrictive, answer is vital capacity. Now, the final thing I want to discuss here is that which is the only obstructive lung disease, okay, where diffusion capacity is also less. Normally, I told you in restrictive lung disease, diffusion capacity is less. In obstructive lung disease, it is normal. But a very, very important clinical point, which is the only obstructive lung disease where diffusion capacity is also less. Can anyone can comment in the chat box? Any answer? Any answer? Answer is emphysema. Emphysema is the only obstructive lung disease where diffusion capacity is decreased. Otherwise, diffusion lung capacity will be less only in restrictive lung disease. Whenever you see DLCO is less, whenever you see DLCO is less, you always say, what? Restrictive lung disease. But pattern is of obstructive. And even then, DLCO is less. Answer is 100% emphysema. Now, let me discuss some example of obstructive lung disease and some example of restrictive lung disease. Obstructive lung disease examples are A, B, C, D. A for asthma, B for bronchitis, C, D, COPD, chronic obstructive pulmonary or COPD, chronic obstructive pulmonary lung disease. It can be chronic bronchitis, it can be emphysema. In case of restrictive lung disease, they are because of the fibrosis. It can be asbestosis, berylosis, okay, then anthraconosis, then tuberculosis, then pneumoconiosis. Whenever parenchyma is fibrosed, answer is always restrictive lung disease. Is this clear? Okay, so this is it for today. Hope to meet you this Friday. All the best. Take